the Adam images. The salivary glands, parotid and submandibular, sublingual, we talked about before. This is actually an accessory parotid gland. I don't know what this is. Anyone know what this is? Anyone come across this? This little funny looking thing in the eyeball? A lacrimal gland?
Yeah,
Could be.
that's what it is.
Could be. Yeah, that sounds good. Thanks. That's
No, I'm pretty sure that's what it is.
one for you and one for you.
Lacrimal gland.
But the reason I put this up is because of the pituitary gland, which is here. This is the sphenoid bone that the pituitary is sitting into. It's a depression in the sphenoid bone called the sella turcica. So pituitary gland, this is the stalk. And up here is where the posterior pituitary hormones are produced and the other controlling hormones for the anterior pituitary are produced, and that's the hypothalamus. The pineal gland is up in here. It's not really on this picture. That's what I want you to know on that. This is an image that I hope all of you are familiar with by now. This is the first part of the duodenum. This is the pyloric sphincter here. Duodenum coming around, entering into the ileum, which is here. And this is the pancreas. So that's the pancreas. That's the spleen up here. And what you're looking at here is the kidney. And this has got all that perirenal fat. You're looking at the kidney from the outside with all the fat around it. It actually does sort of look like that. But again, endocrine pancreas. Okay, you looked at the glands before. That's the lacrimal gland up there. Anyway, thyroid gland. This is the thyroid cartilage, cricoid cartilage, thyroid gland below it. It's kind of a bilobed gland on either side of the trachea, which is here. And on the back of the thyroid gland, typically there are two on each side, are these little things, and these are the parathyroid glands, the ones that do calcium metabolism. It's a good diagram, and it shows them. You might need to know that. So thyroid is the biggie, parathyroids. And it's the same thing on the other side. Another Adam image, and this is a thymus gland here. Just incidentally, this is not an accurate depiction of a thymus because this is an adult male, and the thymus is not that big in an adult male. It probably reaches its peak. I think we talked about this around puberty, and then gradually gets smaller. So depending on how old he is, he looks about 36 to me. This is way bigger, but for the purpose of knowing where it is and where it's situated, that's the thymus. Okay, male external genitalia. This image is not in your book. There's one like it in your book, and it's certainly in Adam. An image like this is going to be on the exam. This is something you need to know. So, starting from the outside, the sac of skin that surrounds the testicle is the scrotum. The testicle is here. This structure is the epididymis. This is the head of the epididymis. Comes down. Down here is the tail of the epididymis. And coming out of the epididymis is the ductus deferens, or vas deferens. The ductus deferens continues up loops over the bladder, kind of the side of the bladder. This is the ureter coming down. So if you, surgically, well, we don't do very many stones through open surgery anymore. Almost everything is done endoscopically through channels. But in the old days, when I was first in practice, we did a lot of open surgical procedures to remove stones from the ureter. And this is by far the most common place in the ureter that stones would typically lodge, because it's the narrowest part of the ureter, just about where it goes into the bladder, which is here. And so when you would, in order to identify the ureter, what you would do is you would identify the top of the bladder, and you would then dissect down until you hit the ductus deferens, and then you knew you were right above the ureter, and the ureter was right below. So anyway, so the ductus deferens comes around. This part, this kind of widened part of the ductus deferens or vas deferens is called the ampulla of the vas, A-M-P-U-L-L-A. This structure here is the seminal vesicle, produces a lot of the seminal fluid. The seminal vesicle and the vas join right here and form what's known as the ejaculatory duct. The ejaculatory duct contracts during ejaculation, and it sends the seminal fluid mixed with the sperm from here, seminal fluid from there, through this gland, which is the prostate gland, surrounding the urethra. This is the bladder, this is the male urethra, and this is the prostatic urethra here. The prostate gland also produces seminal fluid. So the ejaculatory duct comes right through the prostate and empties into the urethra right here. And what happens with ejaculation is that this contracts, sending the fluid into the urethra. The bladder neck closes so that the fluid doesn't go this way and take the path of least resistance. And there are muscles called the bulbocavernosus muscles that contract, and they kind of rhythmic contraction, and they push it out. It's a kind of a peristaltic process. So this is the membranous urethra here, prostatic urethra, membranous urethra, and this is called the spongy urethra, the penile urethra, the pendulous urethra, various urethras. The erectile bodies, the top one here is the corpus cavernosum. The lower one that the urethra is coming through is the corpus spongiosum. That's why they call this also the spongy urethra. This is the external urethral meatus, where the urine comes out, and this is the penis, and they've kind of depicted, this is an uncircumcised male, so this is the foreskin here and here. Okay, and then posteriorly, right behind the prostate is the anus. This is the rectum here, and when men go to a urologist or general practitioner, some of them do it also, in order to examine the prostate, the way they examine it is by doing a digital rectal examination and feeling the prostate anteriorly. The shortcoming of that is that, from a clinical point of view, is that you can only feel the posterior surface, the back surface of the prostate. So if something's going on anteriorly or in the middle, you may not feel it, but from a statistical point of view, probably 60 to 70% of prostate cancers originate in that posterior area, so it actually works out pretty well. Questions about that?